Hello and welcome to the Impact of COVID-19 webinar on mental health and pregnancy. My name is Gerard Moore from Focus Gulf Conferences, and we are joined today by Dr. Samir Makhoul and Dr. Faisal El-Kak. They will be speaking respectively on mental health and on staying safe the morning after Corona. Dr. Samir Makhoul is the consultant psychiatrist and deputy CMO of the ACPN in Abu Dhabi. And Dr. Faisal El-Kak is a senior lecturer at the American University of Beirut, and he also chairs and presides over various federations in the OBGYN Society. Just a few housekeeping issues before we start the webinar. There is a chat function on your right-hand side. You can please use it to ask scientific questions. I will put them to Dr. Samir and Dr. Faisal after each call. If you have any technical issues, you can click on the admin button and then you can ask me directly of those questions. We will send you a certificate of attendance for your self-learning records after the event, almost 1 to 2 weeks after the event. I would now like to introduce Dr. Samir Makhoul, who will give the first presentation on the impact of COVID-19 on mental health. Dr. Samir, it's over to you.
Thank you so much, Gerard, and thank you all for being with us today. I think with everything is happening all over the world, to reach to people through technology, it's amazing. And I think we're going to see more and more of those webinars. So I'm going to try to cover a little bit about mental health and COVID-19. For people, I know we have a lot of people from different countries, and I know a lot of people, maybe haven't been to Abu Dhabi. So I'm going to show you, this is a view from my bedroom. This is not at the moment, but, some of the best time in Abu Dhabi. So hopefully after everything, calm down, we would love to see people here in Abu Dhabi. Okay, so what's the agenda for today? I'm going to talk about disasters and pandemics, what's the psychological impacts. I'm going to talk about quarantines, the psychological impact as well, how we support patients during pandemic and disaster. And I'm going to touch a little bit, some opportunity to educate people about mental health. So I'm going to mention a tiny bit about mental health at the end in terms of common mental health and their treatment. So starting with disaster classification. Obviously, over the years, we had a lot of disaster from the day one when, they were like a human being. And there are two types of, disaster. We have natural disasters and we have human-generated disasters. Natural disaster, as we know, floods, we see a lot of those over the years. Earthquakes, obviously, tsunamis. We had major tsunami about 10 years ago that, had a huge impact on some part of the world. We have wildfires, and I think wildfires, 2020, we started with this, I think in Australia, and there's a lot that happen usually in California and the United States. Of course, there's war, terrorism, and sometimes transportation accident like airplane crashing. But the toughest one for us is pandemic diseases. And I'm going to talk a little bit about that, and why it is different than most of the other disasters when we try to compare to them. Before we go to the next slide, I'm going to try to show you a video. Hopefully that's going to explain a little bit more about why pandemics are quite quite important and different than other disasters. With this video, this is a video by Bill Gates, and hopefully many of you have watched it. But I'm just going to highlight it's a very brief part of it, and I'm going to highlight this is 5 years ago, and we'll move to the videos. I need to give you this one. Go there, and I'm gonna try
the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. Lots of tough challenges. I followed it carefully through the case analysis tools we use to track polio eradication. And as you look at what went on, the problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces.
And going back to our presentation. Okay. Slide presentation, start presentation, start. So as you can see, from the video from Bill Gates, this is 5 years ago, and it is very clear, that we were not ready. And I think today's event in every country, I think all over the world, shows that, we are not ready for a, pandemic like what we have at the moment. And that's why a lot of people possibly dying at the moment. And, we have all these things that we're having. But going into disasters, the size of psychological impact or the psychological footprint is much bigger than the medical footprint. In other words, so the medical impacts that impact on people, because of the disaster, compared with psychological impact, we can see the psychological impact is much bigger than the actual medical impact. And, when we look at that, we see the disaster impact, we see a lot of people having different reaction. So the biggest reaction we tend to see is a fear and distress response. And, I think, many of us has watched on TV and over the news, how people panic and they went to supermarket and they were even panic on something. And a lot of people still don't understand why there was a panic to buy toilet roll, for example. But there was a major panic, and you can see that in almost every country all over the world about this, So then there was a behavior changes that we can see in those disasters. And most importantly, also the impact of disaster would cause some psychiatric illnesses that we need to look after more during the time of disaster and after. So we tend to see with disasters, the disaster impact, we tend to see exposure initially. That's when we have the disaster exposure on us. And, with time, we can see a lot of losses. So not always the losses, they come, straight away with the exposure. It takes some time to see, and we can see that with COVID-19. So we have that, and then the number of deaths happen day after day. And then with time, we see the impact because of the disaster make a lot of impact and a lot of changes in our life. Looking at this, picture, this is, tells us what I was talking about, the disaster, when we expose to hazards, the losses and the changes on the population. And if we go in more details on this, we can see that individual, if you look at the first part of the picture, we see there's an impact on individual and family. We see a bigger impact on community. And there's always the social and the structure context in impact because of the disaster. So there's a lot of characteristic about the people and how they impacted by the disaster overall. So we have, the age plays a role, the gender plays a role, the race, whether, depending on country, your race, and sometimes ethnic minorities, they suffers more because of the disaster. The family structure plays a role. Protective factors, at times we find people are ready for disaster, and this is for areas that they have, the occurrence of disaster rather than pandemic, and as you can see from when Bill Gates, we are not ready at all with, we don't have a plan for disasters like this, we see, when sometimes there's evacuations, there's, a lot of structures there. But also what plays a role, and we're going to talk about that a little bit later, about socio-economic position, level of education, what's your occupation, all of that has a major impact also, and how our reaction and how we get affected because of the disaster. Going to the bigger context, the community, local and political structure and governance plays a major role. And we can see actually at the moment, looking at different countries all over the world, and depending on the political structure, we can see how China did manage the pandemic with COVID-19. We can see how Europe is dealing with that, the Middle East and the US. And, you can see, a lot of, political impact at times, about how people are dealing with disaster in different countries. And that plays a major role actually in major pandemic like at the moment. And the community infrastructure, health services, social services. When we talk about health services, I think now in Europe, the major problem was finding beds with, equipment that can deal with COVID-19. And countries like Germany, who had a lot of, ratio of beds compared to their population, it seems to be coping better than, for example, the UK, where the ratio is much less. What is the local emergency management? Is there anything, in place? What's the social environment? What kind of social support, the people can get, from the community? So all of that plays a role. Geography also plays a role. So, an example of that is New Zealand at the moment. When you see New Zealand, because where it is located, and when they did the lockdown in New Zealand, the number of cases, like straight away went into very minimal, and the number of deaths as well, because of the location and probably the geography. In other disasters, also geography might play a major role, with floods, stuff like this. When we talk about the national political structure and governance, how people can deal with that, the legal environment, when they can stop, or where they can enforce quarantine. So that was a problem in some of the countries, how they can enforce quarantine. And sometimes because of disaster, not the pandemic at the moment, I don't think so, but there might be a little bit of violence and looting, and that has an impact on community as well. So, quarantine and isolation. And this is a kind of probably now the word that we hear everywhere. So I need to give you a difference between people, because sometimes we use both terms at the same time, when they are as the same term. But quarantine is the separation and restriction of movement of people who have potentially been exposed to a contagious disease to a certain if they become unwell. So reducing the risk of them infecting others. Just an hour ago, I was speaking to one of my best friends, who works in the general hospital. And he said he is now in self-quarantine because he came in contact with a patient that had COVID-19 or tested positive. They discovered that after a couple of days. I mean, he has minimal contact. He was very careful. Everyone was, wearing protective gear. But because of this, he's putting himself in self-quarantine until the test comes back, whether it's positive or negative. And, that's a lot happening all over the world, when we restrict the movement, of people. While isolation, this is a different definition, is the separation of people who are diagnosed with contagious disease from people who are not sick. And we see that in some countries, we're trying to isolate those people rather than put them in self-quarantine to make sure that the disease or COVID-19 doesn't go from one person to another. So how do we know whether quarantine would have an impact on us or not? So we have some predictors, we can use to predict whether the impact or psychological impact would be negative. We know younger age, they tend to have a negative psychological impact when they are quarantined. That's between age 16 to 24. Obviously, lower level of formal education and qualification, we see those are more prone to psychological impact that is negative. Usually in mental health, a female has, worse in terms of like more depression, more what they call them eating disorder. A lot of diseases, female has worse outcome. And in here also we see is there's negative psychological impact. However, the only good news for female is when looking at the numbers, the number of female that dies in comparison to male is significantly less. But for psychological impact, there'll be more disadvantage. Interesting enough, in some of the studies, they found having one child as opposed to no children have more negative psychological impact. However, having many children, more than 3, is actually positive. So one child is the worst, then comes no children, then comes you have 3 or more. Having a history of psychiatric illnesses obviously will associate with anxiety and anger, and that lasts for up to 6 months after release from quarantine. So the impact, we're not talking about just at the time of the quarantine, we're talking about later on. And many of you, if not all of you, are healthcare workers who are watching this webinar. And we know healthcare worker who had been quarantined had more severe symptoms of post-traumatic stress than member of general public who had been quarantined. And they were scoring higher on all dimensions. So I think healthcare worker with quarantine, based on some of the study, they have much worse negative impact on their psychological impact. So why quarantine is quite relevant, and what kind of stresses we have, during the quarantine. The main one is, we talk about the duration of quarantine. The longer it is, the poorer your mental health, specifically post-traumatic stress symptoms, avoidance behavior, and anger. And unfortunately, with COVID-19, it seems that we need quite a considerable period of quarantine that is tend to be quite long. And this is, I think, would be one of the negative impact on mental health. Fears of infection. Fears about their own health or fear of infecting others, and we're more likely to fear infecting family members than those not quarantined. So we have, the stress during the quarantine, and I think that also goes for all the healthcare professional or anybody who has to go out and do their work, essential workers at the moment. Because with the quarantine, when they go back to their quarantines, they have significant fear about infecting the family member, than other people. So this is quite also important, to look at. Frustration and boredom. Confinement, loss of usual routine, and reduced social and physical contact with others were frequently shown to cause boredom, frustration, and sense of isolation from the rest of the world. And this is tend to be distressing to people. And, for example, when we talk about, boredom, this is something, a lot of people, they talk about at the moment. We might have quite few at the moment, they felt quite bored, and they said, why not to have this webinar to pass time? However, hopefully that will be quite resourceful for you, and that would have good benefit rather than because of your bored. But, those also, the boredom and frustration, I think is a major thing now we hear from a lot of people around us, not just our patients. Inadequate supplies, having inadequate basic supplies, food, water, clothes, or accommodation during the quarantine, it has a lot of impact on after quarantine, after being released, having anxiety and anger for about 4 to 6 months. And being unable to get your medical care or your prescription also is a major problem. Inadequate information, poor information from public health authority as a stressor, reporting insufficient clear guidelines. So that's obviously very clear. So stressors post-quarantine is also measures. Financial losses can be a problem during quarantine with people unable to work or having to interrupt their professional activity with no advanced planning. And in a pandemic like this, I don't think there's a lot of advanced planning people would expect for that to happen. And this effect tends to be long-lasting, and we can see, a lot of businesses now collapsing, a lot of people losing their job, and that's very important, to consider, because people, they would have that consequences after quarantine or start during the quarantine, and it is a major issue that has a lot of impact on psychological stresses and negative outcome. Stigma from others was a major theme throughout the literature, often continuing for some time after quarantine, even after containment of the outbreak. And interesting enough, I'll give you an example. I had a patient yesterday who came to see me, and he said, yes, I was quarantined. He works in a healthcare facility. And he said, because one of the doctor in English, I would say the word is, he was caught in Arabic, kamashu or la'atu, with the coronavirus. And when you have this, as if you get it, because anybody can get it, within that health facility, but the stigma around it, like, as if he was a criminal and they managed to catch him and put him in isolation, it feels like, it feels the stigma that is going to last for some time, And the impact on mental health, obviously, following the quarantine with multiple health problems, such as anxiety, health anxiety, OCD, depression, and PTSD are major. So what can be done to mitigate the consequences of quarantine? Information is key. People who are quarantined need to understand the situation. Effective and rapid communication is essential. So they need to know things from early days. Supplies, both general and medical, need to be provided, and that's very important. I know for people in the UAE, they will understand that, how people got relaxed when the leadership here in the UAE said from the beginning, food and medicine would be always available. Don't worry, or la tshilun ham. This is very important. That put a lot of people on ease and stop the panic, and that's quite important when you give them the message early, and you tell them what's reassurances, but it has to be, of course, clear reassurances. Quarantine period should be short, as we said, and most of the adverse effects comes from putting people in quarantine, so they were forced to do that rather than doing that from unselfish behavior. And as I said, healthcare workers deserve special attention. So what advice can we give to our patient or people? Okay, during disaster, we say, we know people listen to the media, online chat room, people who are anxious make people over anxious. And that's quite common, so there's a lot of conspiracy theories, a lot of anxiety, a lot of false information, So the advice for those people who are anxious or over anxious to limit exposure to media sources that cause anxiety if this makes the person anxious. Try to avoid having notification buzzing on your smartphone. I have a lot of friends that they have, the smartphone subscribe to a lot of news channels. So every 10 seconds or every minute that's, they go like buzzing, there's something new, number of deaths or stuff like this. However, advise people, they still need to know what's going on, because that's, would help us to deal with the pandemic we're having at the moment. So they need to listen to official sources like government sources and listen to the advice given. What else? Social contact is good for people's mental health. If at home at the moment, they should connect to people. Now we have technology, WhatsApp, telephone, video conference, all of those. So we need to encourage them to do that. We need them to be proactive, not to wait to get like a phone call or video conference with their family, friends, or loved one. That would help them, and it might help other. So when I contact with somebody who's distressed, that might give them support as well. We need to advise them to avoid unhealthy habits. Addictive behavior like smoking and alcohol tend to be very, very much increased during this period. Avoid speaking late, watching the media, because your brain will continue to be kind of panicky and cause anxiety. Try to eat healthy, and we tend to see a lot of eating during this because they have nothing much to do while staying at home. And rarely people exercise, so we need to advise them to exercise when possible and doing something they enjoy, like reading, watching films. And I think Netflix at the moment has been widely used for things like this, which actually is slowing the internet everywhere. So they need to look after themselves physically, as we said. Spiritually is very important, and emotionally as well. So older people, they have less contact, unfortunately, or no contact because of pandemic like now. So we need to help them to use the technology, iPad or phones, to use some kind of contact with their family members. Finally, we need to advise them to seek help if they cannot stop feeling anxious or depressed. I'm going to move to something like, some of the two more points we're going to cover. One is, how can we support our patient at the moment? And as you can see from this picture is, going to some using the technology, we in psychiatry, we call it telepsychiatry or telemedicine, is important to use. With using telepsychiatry, just to give you a few tips, because we started to use it at the moment, or telemedicine, you need to make sure to have a good background. Obviously, at the moment, I don't have the best background because I'm at home. But usually, when I speak to my patient in the office, I have a good background. The lighting is important. Whether you might have a plant or some decoration, what you're wearing at the same time, is quite important. It's not like because you're doing video conference, you can, it's important to consider what you're wearing. Good camera resolution, because a lot of places they have older laptops or older desktop, and they have old cameras, so we need a better resolution, good headphones or mic kits. Confidentiality, it is quite important, so we don't have people coming in, coming out. It feels for the people like the confidential part is there. Cultural respect, so whether male or female doctors. And when I say nurse chaperone, an example would be in some of the recent consultation, we wanted to have a video conference with the lady, and obviously I need to see her face because to make sure that that's the patient, but because of the culture bit, and I might be invading their privacy inside their home. We had one of the nurses to go and check her and said it's confidential, doctor is not seeing. So she made sure that this is the patient that we're seeing, and then I managed to do that. And it's to see her and give the consultation after that without having to see her face. Note keeping is also important, because we do this consultation over the teleconference, so we need to record everything rather than because that means we need to use two systems, so it takes time. The Royal College of Psychiatrists, they mentioned some of impact of virtual and remote working on mental health, and just to give you some of the things they said they need to adapt quickly to working differently during this pandemic. So much of the routine work, including consultation, will need to be done virtually, and I think that's a must when you have people cannot leave the house. This requires changing of number of area of practice. So how do we assess risk in psychiatry based on remote consultation, how we do confidentiality and record keeping. So a lot of things we need to do it in a different way. And that's actually, we're learning to do it. People who used to do telepsychiatry or telemedicine before, they'll probably can give more advice, and there's a lot of webinar on this at the moment. So that's quite important. Any alternation to service, especially withdrawal of routine treatment, because of COVID-19, because we might give resources to people to work with COVID-19, would impact on the health and emotional well-being of our patient. So we need to be very careful on this and ensure that doesn't impact a lot on them. So we need to make sure that our patient and their family are well informed. Finishing with common mental health problem and treatment, with during my presentation. Obviously, depression is the leading cause, and it was supposed to be in 2030 to be the most leading cause of disability. Look at, for example, diabetes, you can see depression is much higher. Only cardiovascular comes behind it. And actually, at the moment, it is, or 3 years ago, it is the leading cause of disability, and that's very important for two reasons. One, because stresses like this would increase the number of cases of depression that you might see yourself. And on the other hand, we might have patients already with depression that they need, the depression get worse. And it's important to familiarize yourself with how to support patients like this. Either advise them to get treatment or even support them to get treatment. And most of the time, treatment can be as cognitive behavior therapy, or it can be medication. And in one of landmark study we have, it's called it's called the Cipriani in 2009. They found there's 4 medications, they are superior than others. They are escitalopram, sertraline, venlafaxine, and mirtazapine. And moving to the last point of mental health I'm going to cover is patient with schizophrenia. Patients with schizophrenia, they tend to be stigmatized a lot when they go to normal medical facilities, because people suspect that the illness is not there or anything. They're complaining about is not there because of their delusions. And schizophrenia, yes, people, they have different they have different way to look at the world when they are unwell. So this is one of the quite common pictures that we have for somebody who used to draw cats when he's unwell. You can see with the first one, and every cat after this, we can see the patient's state of mind, how he's seeing the cat and how he's drawing the cat is changing. However, schizophrenia is one of the diseases that respond very well to treatment, and it's very simple. Everything works. We can see there's no difference in antipsychotic or any antipsychotic we give. So everything works. I mean, there's one antipsychotic which is superior, it's called clozapine, while everything else is similar in efficacy. What we do with patients with schizophrenia, by choosing the medication, we tend to use it based on side effect. So historically, it was extrapyramidal side effects, while now we care about metabolic syndrome and things like this. So going back to my view from my window in Abu Dhabi, hopefully we'll see you here. Just to say, our sponsor, today they have, 2 products in psychiatry. They asked me to share with you. One of them is aripiprazole in 3 doses, 5, 10, and 15, and venlafaxine, which is in 2 doses, 75 and 150. And I would like to thank you all for listening to me, and hopefully at the end we can answer some questions.
Thank you, Dr. Samer. That was a very, very insightful presentation. I have a couple of questions which I kept, if you wouldn't mind answering them.
I'd love to, yeah.
One question was, do you think the situation will increase the possibility of depression significantly?
Yes, I've already seen that. I've already seen people being impacted on this. And I'm going to say there's a few factors with this. One of them is the pandemic and the impact on pandemic all over the world. So we're seeing people dying,